It was amazing to me, very eye-opening, and probably to Dave as well, how much confusion there was and how much there was a need for what we are doing, providing structure, providing visibility, providing them data solutions. Bill Mohn, Vice President of Business Healthcare Development.
My name is David Rouleau. I'm the Regional Director of the Midwest region for US PAC.
Dave and I have been working together for over a decade and have worked across many, many different healthcare customers of all shapes and sizes. It became quite apparent when I was talking to different health systems or different pharmaceutical customers that to be successful, I needed to leverage Dave's team, what they see day to day running the logistics for all kinds of health customers.
You really need to build that relationship and trust and understand what it is about patient care that they're most concerned about. We've got routes in some hospital groups that are doing supplies and labs and pharmaceuticals, and how to put that all together and not affect patient care is really the tricky part. But that engagement with the customer and understanding what they need, even though they don't understand what they need, a lot of the times is really the most important part.
Especially in these larger systems, you're dealing with different departments that all have competing interests. So, and Dave kind of explained this to me, of how important it is to go in and understand everybody's needs, everybody's views, because, for efficiency's sake, they're all utilizing the same network, but they all have different takeaways that they need.
And you really got to get all departments together at some point and have those meetings about, what happens if we add this additional work on, how's that going to affect me? At the end of the day.
Dave and his team are really, really experts at going in, breaking that down, improving communication, improving reporting, and kind of building a new system that everybody gets what they need out of.
And in the background is always cost, right? Because ideally, what you'd want to do is have a separate courier for each department, right? You got your lab courier, you got your pharmacy, and you got your supplies, whatever that looks like. So trying to combine all that and make that work from a service standpoint, a patient care standpoint, and a cost standpoint is really, really tricky. But if you work well with the customer and you meet regularly, you can hit that sweet spot of where you need to be.
It's probably the thing that I mention the most in a potential new customer that has that kind of situation is that we want to over communicate and put a mirror up to them, basically, where we can say, here's what's going on, and through all of our experience dealing with a lot of different customers, here's a suggestion of how you can move forward and everybody gets what they need out of the system. They find relief in that somebody's going to ask me questions to help me actually understand what we're currently doing and what we can suggest to them to improve it, and really, in a lot of respects, just understand it. And that can be from billing to scheduling to all the different nuances that you'll find, especially like Dave was saying, where there's a myriad of different departments that all have competing interests.
You've really got to come to the table with suggestions. That's what they're looking from their logistics partner. Hey, here's our issue. How do we fix it? And not just pointing the finger, but coming up with real solutions that work for everybody. And if you can do that, that's what a true partner does. And at the end of the day, has a positive effect on the service and the patient care. And that's what they're really looking for.